Meera. I think we have covered a lot about pain. Can you give us some idea of how patients should bring up pain when they are meeting their providers?
Yeah, that's a really good question. So I think the first thing we want to emphasize is that you should not have to live with pain. It's really important to bring up your symptoms, bring up your pain with, even if it's mild, with your provider, with your oncology team, so you can work to address them together. We want to highlight that many types of cancer-related pain can be managed effectively. You can describe pain to anyone on your team, as Karan mentioned, nurses, nurse practitioners, oncologists, medical students, and they can help determine the best way to manage it. So Karan, let's say I'm a patient and I'm seeing my oncologist about a new pain-related symptom. Can you help me role play a little bit? What kinds of questions an oncologist or a provider may ask a patient who's presenting with a new pain symptom?
Yeah, let's do it.
Okay, so let's say that there's a patient, with early stage breast cancer who's coming in with new onset back pain. What are some of the questions that her oncologist may ask her about her pain?
Yeah. So some of the most important questions that we always think about is, when did the pain start? Is it a new pain? Is it an old pain? Is it a pain that has been exacerbated, that was already there, and now it has gotten worse? So that's one. Second is, we always use this objective scale, that is the pain scale. We divide it from 0 to 10, 10 being the worst kind of pain you have ever experienced, and zero being no pain. Now, some patients can have different answers to this, and that's totally okay. At one subjective time point, pain scale can help you, but the majority of the times we see the most help from the pain scale is when we do it at regular intervals to assess whatever management we are giving the patient, is that even helping them or not.
Mhm.
Um, the character of the pain can be really helpful. Sometimes it's, in patients with bone metastases, it can be a short pain. In patients with pancreatic cancer, it can be a dull pain. Similarly, we expect, or we think that there are certain types of characters of pain that can be associated with different kind of cancers. Now, I just want to caution everyone that just because you're having one kind of pain does not mean that that's the reason for it. It is always helpful to talk to your physician before making an assumption or conclusion on your own. Um, as you mentioned, is it constant? Does it come and go? Some of the important things, especially for patients who we see, patients who have cancer, is if they are taking pain medications, is their regular pain medications even helping them? Has it stopped helping them? If they are taking more dosages of the same medications that they are using, and that's controlling the pain at all or not? So, and the last but the most important thing is it limiting your ability to do anything? Uh, Pain can be a most important determinant for someone's quality of life, as you correctly mentioned. So it is always helpful to see, is the patient unable to cook anymore? Is the patient unable to sleep? Like the pain is disturbing so much that it is hampering the quality of sleep. So all these factors go into taking the history of the patient. And this is just one way of explaining. This is something that the patients, if they have in the back of their mind, even if the physician forgets to ask them, this is always important to bring up to tell them the quality of life aspect as well.
Yeah, that's really helpful. And absolutely, this is by no means an exhaustive list, but just an example of some of the questions that your providers may ask you about your pain that can help them determine, the best way to manage the pain. Thanks
Yeah.
so much, Karan. We also want to mention that sometimes a family member or caregiver may have additional perspective or have noticed changes to your pain. Sometimes, when you're going through, the diagnosis and the treatment journey, little changes day to day can be harder sometimes for patients themselves to notice, but often it will be family members and caregivers that notice, oh yeah, a few weeks ago you were able to do the dishes without any issues or walk around the block without any issues, and now that seems to be more difficult. So always helpful if you can to have a family member or caregiver present to give that extra perspective.